But today I'll talk a little bit about what Pilates is all about and why you could potentially do Pilates to help your pain. I will talk a little bit about core strength and core strengthening, so you know how to engage your core muscles. And then after that, we will go through a couple of exercises, or Pilates style exercises. So if you would like to join, then feel free to join. Just wear some comfortable clothing. You need a mat because we will be doing a couple of exercises on the floor. The exercise routine will take roughly 15 to 20 minutes. So if you do want to grab water as well, just in case, then do that as well. In terms of comments, please, if you've got any questions, pop them in the comment section. I know that Zoe will be here as well and trying to answer some of the comments. So if there's anything left over or anything she doesn't know how to answer, I'll jump in and hopefully can help. I will check the comments after I've done the talking bit about Pilates, and then while we do the exercises, I will not check the comments just because it's more of a routine. So we go from one exercise to the next exercise. But after the exercise routine, I'll take the comments as well. So if you've got any questions about the exercises, or you feel like something didn't feel right, or you're uncomfortable, then please then pop it in the comments. And then with regards to the exercises, so obviously make sure that you do have the all clear from a healthcare professional or your rheumatology team that you can take part in exercises, because obviously I don't know where you are in terms of pain levels, in terms of your disease activity. So if you feel like it's not right for you, then please don't join in, if that's okay. Right, so we've got a few more people now. I will start talking about myself a little bit first of all, so you know who you're dealing with. So my name is Wiebke, and I'm a qualified chiropractor. I also suffer from psoriatic arthritis, so I sort of know what it feels like to have chronic pain, to have joint pain, inflammatory type pain, but I also know what it feels like to treat people or to see people who have joint problems, whether it's not inflammatory or mechanical. I am also a massive fan of Pilates. I first got in touch with Pilates through training actually as a chiropractor, because we often recommend it to patients. And then I just started to join a Pilates group, and I thought, oh, maybe that would help me and help me with my pain. And I've been a massive Pilates fan since. It has really helped me to manage my pain, to increase my joint mobility. I feel more stable, I feel stronger, and that's why I want to share my knowledge about Pilates. So maybe some of you might join in and realize as well that it could help you in your AS. And as a chiropractor, I often give Pilates style exercises to patients because they seem to benefit from the exercises as well. Right, but let's talk a little bit about Pilates. I'm sure that some of you might have done Pilates in the past, others have never tried it. So I'm just going to talk a little bit about what it does and why it might be beneficial for you. So Pilates is a type of body strengthening exercise. So it mainly focuses on your core strength. And if you've got a good core strength, then your general fitness improves and your well-being can improve as well. And it's suitable for people with lots of different medical conditions, such as AS, but also other types of diseases. And if you perform Pilates regularly, you can improve obviously your fitness, but also your joint mobility, your muscle tone can increase, your balance, your posture can get better. So lots of different benefits. And that in turn, for example, can reduce your risk of injury. So I don't know, maybe some of you have watched the video last week from Helen about risk of injuries and how you can have increased risk of fall when with AS. So for example, Pilates might be a good idea to work on that and to increase your balance. And the other thing that Pilates focuses on is teaching you how to breathe properly and how to breathe effectively, because you need to have a good core and a good breathing pattern to support your spine and to support your back. There we go. Right. When you do a Pilates exercise, you normally focus on the fact that you don't put your joint too far out of its comfort zone, because that's what Pilates tries to avoid. It tries to avoid to push the joint too far to put extra pressure on it. You want to have it sort of in its normal range, in its comfort zone. So when you do an exercise, then it's quite precise, quite controlled, so very slow, but you want to make sure that you have all the stability to be able to strengthen your core. And Pilates is for people of all different abilities. So some classes are, for example, chair-based Pilates classes. So you're not standing up, you're not lying down, you're just sitting on the chair and you're doing a lot of core strength exercise, and you can still get a lot of benefit from that, even though you're not moving around as much. Some Pilates instructors also use some extra weighted balls or some stretchy band to add some weight to the exercises, but that isn't necessary. You don't have to add some extra weight. And for example, I've got problems with my wrists, so I can't really use those elastic bands, and I still get a lot of benefit from Pilates by not adding any extra weight. And then the other thing I want to talk about is sort of difference Pilates yoga, only because lots of people ask me that at work as well. Which one should I do? What is better, Pilates or yoga? And that's actually a very difficult question to answer, because both focus on core strengthening, both focus on increasing mobility, increasing your posture. So they just have different ways of achieving that. Some style of yoga are more static posture, rather than sort of like flowing type movement like you would do with Pilates. But at the end, you should do what helps you the most. And if yoga doesn't help you, then you do yoga. And if Pilates is better for you, you do Pilates. The most important thing is that you have something that reduces your pain, strengthens your core, and that you enjoy as well. So the other thing I wanted to talk about today is core strength. So I mentioned beforehand, Pilates strengthens your core. So but lots of people don't know, what does core strength mean? And I'm sure, especially with AS, you've been told before, you need to strengthen your core, then you've got less pain. So I want to talk to you about what it means, what a strong core is, and how you can engage your core to then actually get stronger. I've brought a little picture, there we go, which I'm going to show to you. Right, so core stability on its own is maintained by a muscle group. So it's not one particular muscle that strengthens your core. It's lots of different muscles, and they stabilize the pelvis and the spine. In this picture, you can see all the different components of your core stability. So you've got muscles here at the side that wrap around your spine. So at the front here, you've got your abdominals, or your, how do you call it, six-pack muscles as such. Then you've got side muscles here that allow you to bend from one side to another side. And then at the back, you've got these back extensors, so they bring your back backwards. So all of these wrap around your spine and protect it all around the center. But then you've also got two compartments, which are at the top and at the bottom, which also people don't think about. And right here at the bottom, there you go, you have your pelvic floor muscles. And men and women actually have pelvic floor muscles, and lots of people don't think about them or don't engage them enough. But you need to lift up your pelvic floor to have support from the bottom. And then at the top here, you've got your diaphragm. So the diaphragm is a muscle which separates your chest cavity and your abdominal cavity. And it's involved in breathing patterns and teaching you how to breathe properly. So when you breathe in, your diaphragm contracts and it goes down, and therefore increases the pressure in your abdominal cavity, and you're stronger because everything is sort of squashed together, basically. And then when you breathe in, your diaphragm relaxes and it comes back up. And coming back to Pilates now, you have to have that image of top, bottom, and the sides to be able to engage your core. And what we often use is the analogy of a can, actually, by looking at your core. And that's how you can think about your core as well. So you've got your muscles that wrap around your spine. So I just said, we've got the abdominals, we've got the side muscles, we've got the back extensors. Then at the top, you've got the lid. The lid is your diaphragm. At the bottom, you've got your pelvic floor. And all of these parts have to work together, have to be solid, have to be stable to maintain to maintain a strong structure. And that's the same thing. That's the same for the can. That's the same for your core stability. And when you think about core stability, it's not just about engaging your core while you exercise. It's also about engaging your core while you do normal daily activities. And I'm saying things like standing up from a chair. Make sure that all your joints are in the correct position. Make sure your core is engaged. And that way you unload the spine, you unload the joints, and you put less pressure onto something that's already irritated. Okay? And in Pilates, the whole core stability, core strength aspect actually has a term. It's called the powerhouse, because you want to be strong, you want to be powerful to then stabilize your pelvis and your spine. And that's the first exercise I'll show you today, which is how to set up the powerhouse. So if out of all the exercises I'm talking about today, you're taking one home, then take home the powerhouse, because you can practice that throughout the day. You can brush your teeth and you can set up your powerhouse. You're just watching TV, you're sat on the sofa, you set up the powerhouse. So that's very, very, very important to increase your core strength. So that's the sort of talking bit for now. I'll have a look whether there are any comments at all, anything that I can ask. There we go. All right, microphone. I hope it's better now. I've tried to turn it up a little bit. So please let me know if it's still not good. Right, okay. There we go. All right, okay. Yeah. So John is saying if you can do the exercise at all, it does actually help. I have a lot of pain early in the morning, but if I get into the gym and then use an exercise ball to focus on the core, yes, that's a very good idea to strengthen your core. That's actually something I give to patients as well, especially patients who have very sore lower back or sore pelvis, because on the exercise ball, it's easier to bring your pelvis in the right position. In a minute, I'll show you how to work on the correct position of your pelvis. So gym ball exercises are really good, and they are quite easy to do. There are lots of exercises actually that I prescribe to pregnant women, but they are quite suitable for people with AS. So that would be something else to maybe cover in a different live stream. But yeah, very good. So exercise ball, gym ball is always something I can recommend. Right, so let's carry on and we do a couple of exercises. We start off standing. I will have to move the camera, so bear with me for 1 second, and then we carry on. Like I've said to you, I will not check the comments in between the exercises, but afterwards I will. So if you have any problems, then please write them in the comments, and then I'll help you with the exercise afterwards. Right, let's go. Right. So we start off by working on the proper posture. So what I want you to do is bring your feet all the way together so that they're touching each other. And then you bring the weight onto your heels. You bring your feet out so that you're standing in a V shape. Then you bring the weight onto your toes and you come back out. So your feet should be roughly hip distance apart, okay? If you do have a natural turnout, bring your feet out a little bit, okay? I don't want you to be uncomfortable standing there, feeling that your knees are buckling. So, but roughly hip distance apart, okay? And the first thing I want you to do is mobilize your pelvis a little bit. So what you want to do is bring your pelvis forwards and backwards, forwards and backwards. So I'll show you from the side as well. There we go. So bring it in, push it out. Bring it in, push it out. You can start with small movements depending on your pain levels as well, and soreness. It can be a little bit uncomfortable, so ease into it just to mobilize the pelvis a little bit. Also, very good exercise on its own. If you feel like in the morning you're a little bit sore, or we mentioned the gym ball earlier, doing that on a gym ball, rolling on the gym ball forwards and backwards, really, really good. You make the movement smaller and smaller and smaller, and then you stop halfway in the middle. That is your neutral pelvis. So I mentioned earlier that we try and bring the joint in a position where you only put the required pressure on it, but not any unnecessary pressure. And that's what you would call the neutral pelvis. If the pelvis is in the right position where it just about does the work that it has to do without any extra pressure, then that's the neutral pelvis. And that's what you want to train. You want to train to bring that pelvis into the neutral position. So what we're going to do now is set up the powerhouse. We've got the 3 compartments. We've got the pelvic floor, we've got the abdominals, and then we've got the diaphragm. What I want you to do is focus on your belly button and draw the belly button in step by step by step. Initially, you should feel like you have more tension at the front. Then as you pull it in, you should feel the tension around the side going into your back. Yeah? You can sort of think about a belt, as if you had a belt around your spine and you're just trying to tighten it step by step by step. Try to get to the maximum tension that you can get to at the moment. I will talk a little bit more. So if you lose that tension, don't worry, get it back in. Okay? So don't worry. Just take your time. It's very difficult when you've never done it before. So try to get to maximum tension. Try to hold it for as long as you can. So once you've got that maximum tension here, I want you to focus on your pelvic floor muscles. So the feeling that you should get is you're desperate for the toilet, but you're trying to hold it in. So you have to lift it up, squeeze everything down there, and again, step by step by step until you get the maximum tension down there. Make sure that you keep your bum muscles relaxed, okay? So it's just the pelvic floor muscle that you have to work on. Very difficult. Get to maximum tension there. And while you're setting that up, make sure that you breathe into your chest and breathe into your chest sideways. If you can push your ribs up to the side, that would be brilliant. You don't want to breathe into your shoulders, because then you're doing that. You just want to breathe gently into the side here. Right, just hold that for a few more seconds if you can. 3, 2, 1. Relax everything. Relax the abdominals, relax the pelvic floor. I know you can probably tell that this is quite difficult, but this is what you need to practice. You need to practice to set up the pelvic floor, set up the abdominals, and learn the breathing. And like I said to you, you brush your teeth, and while you're brushing your teeth, you draw in your belly button, you lift out the pelvic floor, and you hold it for 5 seconds, for 10 seconds if you can. You relax and you set it up again. And that's like I said to you, one of the exercises I really want you to take home. And you don't have to do it standing. You can do it sat on a chair. You can do it lat on the floor. Not a problem, but that's what I want you to do. So for Pilates, you don't have that maximum tension in all of the bits the whole time through, because as you can tell, it's quite hard. You sort of go with about 30, 40%-ish, yeah? So if you think about the belt, 3 to 4 notches in from the belly button, and then 3 little lifts from the pelvic floor. So that's what I want you to do now. So just with tension in the belly button, bit of tension in your pelvic floor. And that's where you want to try and hold it for all of the exercises. But like I said to you, don't worry. If you lose it, then set it back up and we carry on. So the first exercise I want to work on now is side-to-side movement. So you have your hands down either side of the spine. You take a deep breath into your chest. And when you breathe out, you lean to the side. You run your hand down the side of your leg and you go as far as you can. You breathe out. When you breathe back in, you come back to the center. You breathe out. And you go the other way. You breathe in. And you breathe out. While you do this exercise, you make sure that you keep your pelvis in this position. So your pelvis doesn't move from side to side. It's stable. All the movement comes from the spine. You stay in one line. You're not leaning forwards. You're not leaning backwards. You're just working through the side-to-side movement. Little bit of a stop in the center, and then to the other side. Keep that tension in the pelvic floor. Try to keep the tension in your abdominals as well. When you go to the side, it's easy to lose that tension in your abdominals. So you have to really squeeze it in here before you come back to the center. Lovely. We do this one more time on each side. Come back to the center. And the other side. And back to the center. Lovely. So now we're going to go onto the floor. I'll move the camera again. And then we carry on from there. Lie onto your backs. And you want to keep your legs hip distance apart, okay? So don't bring your knees all the way together or your feet all the way together. Everything in line here. Now we're going to do the same thing that we just did standing, which is those pelvic tilts, yeah? Like I said to you, neutral pelvis essential. So you tilt the pelvis forwards again and backwards again. And forwards again and backwards again. And it feels a little bit different doing it let down compared to standing up. So you can see how It's different in terms of practicing. Make the movement smaller and smaller and smaller, like we did stood up, until you're halfway in between. That's your neutral pelvis, okay? You can double check as well whether you've got your neutral pelvis by see whether you can just about get your fingers underneath your lower back. Okay, there should be a little bit of a gap, but you shouldn't be able to get your hand all the way through. Then you're overarching. Don't be all the way flat on the floor. That tucks in your pelvis too far. There you go. Little bit of a gap, and you've got your neutral pelvis. Now we think about the powerhouse again. Draw in that belly button, 3 to 4 notches. Lift up that pelvic floor. Perfect. And then the exercise that I give you has got 2 different levels. I give you the first one. The first one is very, very good as well. So if you feel like the first one is enough for you, you stick with it. Okay, there's no point in working harder if you lose the stability here. Because the most important thing is that you keep that pelvis in this position and don't lose this position. You don't overarch, you don't push in too far while you do the exercise. So we are in this position, we take a deep breath in, and when we breathe out, we bring our leg up into the tabletop position. Knees 90 degree here, pelvis 90 degree here. And then when we breathe back in, you bring the foot back down. And you do the same thing on the other side. Breathe out, bring your leg up. Breathe in, bring your leg back down. And again, on the first side. As you can see, there's no movement in my pelvis. I'm not wiggling from side to side. I'm not rocking backwards and forwards. It's just the hip itself which brings us up and down. So carry on with that. In your own time, maintain your tension here. Lift up that pelvic floor, keep the tension, and the same thing on the other side. And you breathe out when you bring the leg up, and you breathe in when you come back down. If the breathing is too difficult for you, don't worry about it. It's a lot of things to think about. And again, once more on each side. There we go. We come back down, and the other side, up, and down. So if that is enough for you, carry on with that exercise. I'll give you the next level if you feel like you want to work a little bit harder. So this time we start the other way around. So you start with your legs in tabletop position. Still maintain the neutral pelvis here, okay? It's still all about keeping that pelvis in a neutral position. When you breathe out, you bring your leg down, you tap to the floor, and you come back up. Breathe in. You breathe out, you come back to the floor, you breathe in, you come back up. So we do a few of those as well. Perfect. Nice and controlled, like I said to you. Pilates is all about keeping everything in neutral, having a precise movement, and not going too fast. Good, lovely. And you should really feel how your abdominals here are kicking in when you bring your leg down. Perfect. Lovely. Just do it once more on each side. Perfect. Come back up, and on the other side. There you go. Lovely. And we're going to stretch ourselves out. Arms over your head, legs all the way out, and just lift your back a little bit off the mat here. And you can feel how your abdominals are being stretched a little bit. Good. Well done. Come back into neutral position. And we work a little bit on a glute bridge actually, which is also a perfect exercise when you've got problems with your back. Lots of little muscles that we have to recruit. So also very good exercise to do when you've got AS. So back into your set-up position, legs hip distance apart. You've got our neutral pelvis, little bit of a gap here, but not too big. Pull in that belly button, lift that pelvic floor. And this time I want you to focus on your bum muscles. So you want to clench your bum muscles while you do the exercise. Don't stop clenching the bum muscles. If you feel like they're fading, come back down and go back up. But don't lose that tension in here, okay? You take a deep breath in. You clench your bum muscles, and when you breathe out, you slowly peel your back off the mat all the way into the air. Don't lose that neutral pelvis in here. Don't overarch your back. Your buttocks muscles are tight. And when you're at the top, you breathe in again. When you come back down, you breathe out. Again, nice and controlled. Perfect. And again. Deep breath in, and when you breathe out, you come back up into bridge. The muscles are tight. Take deep breath in and all the way out. Do it at your own pace. You don't need to go all the way to the top. You probably notice that as soon as you lift your bum off the floor, you have to be stable on here. So even if you only go halfway, you work on your core stability. And the glute bridge is also a very good exercise because it has lots of different levels. So if you feel like this is not enough and this is too easy for you, there are lots of different levels in terms of progression. Let's do one more glute bridge. Perfect. And go as high as you want, and then come back down. Good. Lovely, lovely, lovely. There you go. Now I want you to stretch one leg out, and then you grab the other knee, and you just pull the knee towards your chest, just to stretch that back and the pelvis a little bit. Just hold that for a few more seconds for me, please. And then swap legs. There we go. Good. And on this side. Lovely, lovely, lovely. Carry on with that. Good. If you want to have a bigger stretch, you can bring both knees to your chest, but if that's too much, I would just want you to do one leg again and then the other leg. And everyone else who's comfortable doing both legs, feel free to do both legs. Good. Right. Now we're going to go into a 4-point kneeling position. So, there you go. Right. What you want to do is you want to have your hands under your shoulders and knees under your hips. And again, we do a couple of tilts with our pelvis to find the middle, to find that neutral pelvis. So not too far out, not too far dipped in, halfway in the middle. Pull in that belly button, lift the pelvic floor. And what I want you to do is lift one arm off the floor while maintaining the stability in the spine. What you don't want to do is rock around, move from one side to another. The spine is stable. You're just lifting one hand off the mat. Hold that for a few seconds, and then you bring it back down, and then you do the same thing on the other side. When you lift up your arm, you breathe out. You breathe back in when you come back down. Arms first of all. You're not going to bring the legs in yet. Perfect. If you do have some problem with your wrists, the best way to do it is to clench your fist like I'm doing. Instead of bringing your hand flat on the mat, which you can do as well. So hopefully that's comfortable for all of you. Good. And again, this exercise is multiple levels. So if you feel comfortable doing it just on your hands and you don't want to do anything else, feel free to do that. This is a hard exercise. I feel how my core is engaged as well. If you want to do a little bit more, you can also lift up one leg. Make sure you don't rotate your hip, your pelvis, everything remains stable. And then you come back down. You do the same thing on the other side. Bring that leg up, maintain the position, and back down. Or you can do a round. You can do one arm and down, and the other arm and down, and then you can lift one leg up and down, and the same thing on the other side. Perfect. Let's do one more round, everyone. One arm down. It's all about maintaining that stability in the spine. No movement, no rocking backwards and forwards. Join in that belly button, lifting that pelvic floor. And other side. Good. Lovely. Let's do another stretch and more mobility exercise. I want you to do the cat and the cow as well, just to mobilize your back a little bit. You've probably done that before, so when you do, there you go, that's the cow. So you bring your bum up and your head up, and then you come back in and you do the cat. You come back up and you do the cow. You come back down and you do the cat. You can bring the breathing pattern in if you want to. For example, breathing in when you go into the cow and then breathing out when you go into the cat. But again, it's a lot of little things to remember. So if this is too much, then don't worry about it. Just once more. And then you come back down. And the last stretch I want you to do is just go into the normal yoga cat stretch, bring your bum down to your heel and just stretch out your back. Few deep breaths in and out. And you come back up and back down. Perfect. Well done. Okay, so that'll be it for today. I'll put you back up on the chair. So there you go. Yeah. Right. Good. I hope everyone was okay. That's good. So, any questions at all? I hope everyone enjoyed the exercises. Any problems? And just pop the questions down. Oh, okay. Good. Right. Okay. So Heather's asking, she can't get down on the floor, so whether she can do the exercise on the bed. Yes. Yeah. So some of them are a bit more difficult, but the glute bridge, for example, the one that we did, the first one no, the second one we did on the mat, that one you can do on the bed as well. If it's a bit too soft, you might struggle to maintain your balance. So the one in the 4-point kneeling position where we lift up arm, leg, you might struggle to do that one on the bed purely based on posture. But the glute bridge, for example, is a very good one to do. The knee to chest stretch that we did, the cat and the cow right at the end, they're all ones you can do on the bed or on a softer surface. Yes. Right. Any other questions? There we go. Anything else people would like to know? Like I said to you in the beginning, if there's one exercise you want to take home, definitely do the powerhouse or learn how to set up the powerhouse, because as you can tell now, it is not that easy to maintain the powerhouse and to maintain the tension in your abdominals and your pelvic floor while doing anything. So even while you're walking around or you're waiting in the supermarket in a queue, set up the powerhouse, learn how to engage your core, and learn how to lift your pelvic floor. Right. Oh, cramps in the feet when doing the cat and the cow and the cat. Yes, yeah. Especially if you've got shortness in the muscle at the front of your feet, it can be quite uncomfortable. But if you do it on a softer surface again, it might be easier. So doing that one on a bed might help you in terms of reducing the chance of having a cramp, or doing the same sort of movement. Coming back to the gym ball, if you sit on the gym ball and you tuck your pelvis in and you push your pelvis out, you're doing the same movement that you do when you do the cat and the cow, but you're just doing it sat down on the ball, so that could help you as well. Right. Anything else? Otherwise, I'm gonna call it a day. I hope you had fun and you enjoyed the exercises. I'll try and check some of the comments still, so if you've got any other questions, just pop them down. And then I hope that you had fun and you enjoyed it, and maybe some of you have decided that you might want to start doing Pilates to help your pain. Right, then enjoy the rest of your day and take care. Bye bye.